Hi, good to see you.
Hi, Sally. Good to see
Hi,
you.
Mr. Aichura, how are you?
Hello, Sally. How are you?
Good. Geez, our CEO is held up in a conversation with Parliament right now. She was supposed to be the moderator for this session, so I will step in briefly and hopefully she can join us later. So it's such an honor to welcome you to this forum and thank you for taking time to join us. I'll start by sharing some housekeeping rules. I know some people will continue joining in and registering as we continue to have the conversation. But let me just give the ground rules as we begin. First of all, we request that you keep your mic on mute unless you're speaking, and especially the panelists, because you can control that. And then also feel free to share your questions, your comments on the Q&A section, even as we continue with the conversation, because we are going to be picking that up later and delving into it. So feel free to, whenever you have a thought or a question or any feedback or suggestion, please put it on the chat box and then we'll pick that up later for the Q&A session. We'll have our panelists will speak to us from their diverse points of view as experts in different fields with regard to this pandemic. And so we're hoping to hear from them more than anything, and they're the ones that we want to get a lot of information from this afternoon. So let me take this opportunity to recognize our Vice Chairman, who's stepping in also for our Chairman, who is in the same parliamentary conversation that our CEO is in. Our Vice Chairman, Mr. Rajan Shah, has gratefully stepped in and will be taking us and hosting us through this conversation. Our panelists, Mr. Sandeep Raichura, CEO of Zamara Actuaries, Dr. Majid Twahir, Assistant Professor, Department of Medicine and Associate Dean, Clinical Affairs and Chief of Staff, Aga Khan University, and Dr. Mercy Korir, who is a medical journalist at Standard Group. So welcome, distinguished members, and at this juncture, I am very happy to invite our Vice Chairman, Mr. Rajan Shah. Please welcome.
Thank you, Sally, and good afternoon all. KAM members present here today, guest speakers and the panelists who are here today. Ladies and gentlemen, good afternoon. It is a pleasure to welcome you today to reflect on the year that has been in the wake of this COVID pandemic and learn from experts who are on this panel on how we can adapt to and thrive in the new normal. It's been 9 months since this pandemic has set in, and it has actually kind of changed the livelihoods of all of us and the way we actually kind of conduct ourselves in business, in our work life, in our home life. And it has been a transformational change. During this first, since the pandemic set in sometime in February, March, we saw the first wave of this peaking in the months of June, July. Right now we are probably experiencing the second wave of coronavirus globally. And for us businesses, this, as a number of cases continue to increase, the vulnerabilities of both the local and global supply chain are being exposed. A report by Interos found that more than 90% of companies expect the disruption of global supply chains caused by the pandemic to have a long-lasting effects on their businesses. Locally here, we have seen how our health institutions have been overwhelmed, as what we will learn from our panelists today, with our hospitals and clinical staff facing extreme shortages of both manpower and also inadequate equipment to cater for the ever-increasing number of cases. From the manufacturing barometer survey, only 33% of local manufacturers have a positive outlook of the economy for the fourth quarter, which is from October to December. And over the next 6 months, there are 44% who have a positive outlook of a positive performance. This speaks so much volume of the the sentiments within the business community of what this pandemic has done to businesses and what it expects to do in the coming few months. Only 7% of those surveyed firms were operating at near full capacity, and with 43% of them actually responding that they're operating at quarter of their capacities. This response is a grim reality of how this manufacturing sector has been operating. So as we have been grappling with this pandemic, to find a balance between keeping the economy running and reducing the spread of infection, the government has also guided us on how we should kind of take a raft of measures to cushion the economy from the shocks arising from this pandemic. Some of this include measures like reducing the VAT rate from 16% to 14%. Income tax rate, the pay-as-you-earn has been lowered to 25%, and many in the lower income bands are now had been put within the scope of not having to pay any PAYE. Resident income tax or corporation tax has been reduced from 30 to 25%. These are measures, unfortunately, which may not last for too long. And the government is already reviewing whether to reinstate the previous tax measures in January 2021. Currently, Kenya is under pressure to repay its debt. And the shilling, as we have seen, has also been performing in a very unstable manner over the last couple of weeks. I'm happy to say that yesterday we had the board of directors of KAM had a conversation with the CBK governor, and we actually got much positive insights that as far as the shilling is concerned, the macroeconomic matrix relating to our exports, which have been growing compared to 2019, our imports have been reducing. So there is no cause for alarm as far as the shortage of the currency is concerned. And it's sometimes the sentiment which drives the market. And as what we have seen this morning, we have also seen the improvement and the currency kind of also stabilizing itself to stronger levels. Globally, there has been an emerging consensus that the virus could be with us for a much longer period. We have also been listening and hearing globally of all the virus, the vaccines which have been actually come online or are at approval stage. But I mean, in our part of the world, maybe we might not yet see the benefits of this vaccine for quite a few months to come, or possibly even a year. So with that, we need to kind of adapt and normalize these guidelines which have been given by the government as a part of our day-to-day normal business life for our business continuity, and even if we work towards building a resilient local industry. The onus is on us to institute proper safety measures in our workplaces for the safety of our people and the community around us. To this end, the government, to the Ministry of Industrialization, Trade and Enterprise Development, provided us a framework within which these businesses can operate safely. Recently, these guidelines have also been enhanced, and just to mention a few measures that the ministry has given us as guidelines: designation of staff member or team to ensure compliance of guidelines at the workplace, social distancing among staff members as well as clients, at least 2 meters or 6 feet, regular disinfecting of surfaces such as tables, chairs, doors, handles, and equipment, proper waste disposal of used PPEs such as masks and gloves, and designating clear workstation areas and tools for all employees. In addition, the ministry also gave further guidelines for the alcohol industry, amongst which were discouraging any physical activity that facilitates physical contact between customers in an alcohol selling establishment. Alcohol consumption shall be restricted to the designated areas within the establishment, and to maintain a daily attendance register of all members of staff, employees who would encourage, and employees would be encouraged to monitor themselves for COVID-19 symptoms. So all these measures by the government are what, and compliance by the industry is what is going to keep us and resilient for the months to come ahead until we have a full vaccine in place. Ladies and gentlemen, in conclusion, I appreciate the panel of experts here who are here today to give us their thoughts on these issues against the larger backdrop of the global pandemic. I wish you all the best in your interactions, and also wish you a safe workplace and safety of your family as we grapple through and meander through this pandemic. Thank you very much.
Thank you so much, Mr. Vice Chair. We really appreciate your insights. At KAM, we have a saying, we say, let's keep Kenya going, KKM. So we do what we can to keep Kenya going, but let's not forget to keep ourselves safe and everybody else that we interact with safe as well, so that we can all keep Kenya moving. So allow me to take this opportunity to invite the panelists who are going to drive this discussion this afternoon. I will just introduce them briefly. We are joined today by Mr. Sandeep Raichura. He is the CEO of Zamara Actuaries, Administrators and Consultants Limited, and the chair of Kenya Pension Funds Investment Consortium. He has over 32 years experience in pensions, social security, and investment consultancy work, gained both in the UK and in Kenya. Karibu sana, Mr. Raichura. We are really grateful that you're here. The next person, our next panelist is Dr. Majid Twahir. He's an assistant professor, Department of Medicine, Associate Dean, Clinical Affairs, and Chief of Staff, Aga Khan University. He has a strong academic qualifications with advanced experience in medicine and management. So welcome, Dr. Twahir. We're really happy to have you on board. And then Dr. Mercy Korir, who is a medical journalist. Some of you have probably seen her on your screens a lot of times. I follow her on Twitter, so I know her to speak a lot on issues with what to do with medicine and healthcare. So she's a medical journalist at Standard Group, and she has previously practiced as a medical doctor before becoming a full-time journalist. She runs a weekly TV show, health news and feature show, and publishes in Standard Media's print publications. So a big welcome to all of our panelists. And we'll just open the discussions now as I throw the questions to each of you. I'll start with Dr. Majid. Dr. Majid, please give us an insight into the hospital experience, perhaps at your hospital, or what you have seen in general across the country. Maybe you can give us some insight on that.
So thank you very much. It's a pleasure to be here. Sally, if you can share that single slide I sent to you, it would put things into perspective.
Sure.
So as a hospital, we've been proactive from the beginning, even before COVID came into the country. We were already preparing for it. I just want to show you this one slide that shows the parallel between the country's statistics and the hospital statistics. We are mirroring what the country is reporting, except for the numbers, it's almost a factor of 10 to 1. Other than that, everything is, the peaks and the troughs are identical. So if you look at this, what is the story is telling us? Number one is the initial bit when we first got our first patient around about March. It was a slow progressive rise until we peaked towards the end of July. The period where we had now community spread until peaking was about 2 months or thereabout. We peaked towards the end of July, beginning of August, and in about 6 weeks or so, we came down to our trough there around September. You can see exactly the same thing being mirrored in the hospital. So we find the hospital, and the hospital usually is about a week or so ahead of the government. So when we see this happening in the hospital, we are always wondering whether the country will follow. We started seeing a decline in the second peak. We already seeing that decline, and you can see it is reflected in the government as well. We peaked at about just about 60 patients in the hospital, and now it's already coming down. And so our expectation is that in the next 6 weeks or so, we'll hit another low area, which will take us to probably towards the end of December, beginning of January. Unfortunately, we expect it to rise. The gap between the trough period is 4 to 8 weeks or so. So we expect it to rise again from about mid-January. Now, what is driving this? And we can only speculate. Number one is the opening up of the economy resulted in the second peak, the political campaigns on BBI, and that will happen again once we go down. There's Christmas coming up that will drive now the third peak. There is schools opening that will contribute. Fortunately, most of our children will not manifest, but that is also a disadvantage in that they will bring it home, they'll bring it to you parents, they'll bring it home to the grandparents, and we shall see a peak following Christmas and following school openings in January. So that's what we are expecting in the hospital. We've been impacted just as much as the previous speaker has said, Mr. Rajansha, on supply chain disruption. So we initially struggled to maintain a 6-month supply, which we normally don't do because in anticipation of supply chain disruption. So in terms of capacity, the first wave, most of the patients ran away from the hospital, so there was plenty of space. This second wave has been more tricky because our usual regular patients have continued after they've realized that the hospitals are safe, transmission from the hospital is negligible. And so we are now managing both our usual normal patients plus the COVID patients. At this point in time, there's no crisis of beds because the numbers are already declining and we are moving on with our normal operations. The biggest challenge moving forward is the rapidly changing guidelines. What we use today, tomorrow is no longer valid, so we have to keep on adapting and changing. We have a COVID task force that meets 3 times a week that reviews these guidelines and advises the doctors on what is working and what is not working. So I will stop there, Sally, and probably take questions, especially I know there's a lot of curiosity on vaccines. I will take those ones during the panel discussion. Thank you very much, Sally.
Thank you so much. Thanks for that. I'll go right now to Dr. Mercy Korir. Dr. Mercy, please give us an overview of the disease progression, picking up from what Dr. Twahira said. What has been your perspective, especially from covering stories across the country? What have you seen? Because we've had a lot of people talking about, I saw a Twitter thread the other day where somebody was saying that they lost a parent because there was no oxygen or there was lack of PPEs in different places where they were going to and being moved from one hospital to another, and the time that is used to move a patient within that time, I think, is usually critical. So maybe you can give us your perspective. What have you seen, both as a doctor and as a journalist?
Okay, thank you, Sally, and thank you for the entire Kenya Association of Manufacturers for this opportunity. I think the progression of the disease, or what I have seen in relation to COVID, has really been a lot about our own personal behaviors, our own activities, what we are able to do. And as you could see from Dr. Twahir's graph, at the very beginning, where we were very uncertain about what was happening, we were seeing the stories from Italy. I think at the time, Italy was the one that was really hit hard in New York. People were really scared. And so people were indoors most of the time. People were washing their hands. At the time, we were still not wearing masks. So the numbers were lower. But as time went by and we learned a lot more about the disease, we started having our own data and our own analysis of how the disease was treating us Kenyans. We saw that, things got a little bit relaxed. And also as we moved along the way, the government was also relaxing some rules, because here there's been a delicate balance between saving lives and saving livelihoods. So it's been a balance or an attempt to balance between saving lives and making sure that people still are able to go to work. So we could see that when some of the measures were relaxed a bit, you see the numbers that went up. When some of the rallies were happening in Western Kenya, in Kisii, and in those places, you could see that the numbers have been spiking. So there is a very direct link between the numbers we are seeing, how COVID is affecting us, and the activities that are happening generally across the environment and the society. And so when we see that there's a dip, it's because when there's been a peak, people now it's a wake-up call that, this disease is there, so people start being a little bit more cautious than before. So having said that, we've seen that the disease has been, it's really what I call a slap on the wrist for us. That 90% of the population have not had any symptoms. You could have many people walking around, they've had COVID, they've not had any symptoms, so they actually don't even know that they had the disease, and 10% are the ones who have really been affected. And now, unfortunately, that when among those 10% that are affected, when they are diabetics or they have hypertension or they are borderline that can be tipped into diabetes, for example, then they suffer the adverse effects of COVID-19, and some even die. And that's why there are stories of people who've lost parents, because these are people who are elderly, 80 years, 70 years, and when they get the disease, it really affects them a lot more. So it's that population, the vulnerable population, that when they get the disease, then they suffer the adverse effects of the disease more than everyone else. Now, this disease got us and our healthcare system at our bad state. It's not like we were doing any better or we were improving, we were still struggling. The same issues that we didn't have oxygen were also still there. The same issues that we didn't have enough blood in our health facilities were still there, that we didn't have enough personnel. So all of these issues were still there even as the pandemic came in, that we are not able to do enough testing, not just for the COVID-19, but for other diseases, was still there. So it found us at a vulnerable point, and that's why there was really that call for people to make sure they don't get the disease, because we know the state of our healthcare system. And when I talk about that state of healthcare system, we have Nairobi, which is very different from the rest of the country, because in Nairobi, you have options to choose from, and especially if you have money, or if you have an insurance, you have options to choose from. But there are people whose only option is that healthcare facility or health center that is government run or county run that has all of these issues. And so the worry was that, if we get mass infections, then we will lose a lot more people, because it's not like COVID came and all of a sudden our facilities were at their best. So these issues have been there. There've been efforts and attempts to improve this, like employing a bit more healthcare workers, getting funding to improve our oxygen levels in the country. The other day, and I put this on Twitter, is one of my colleagues in one of the facilities was telling me of a nurse that they work with who lost her mind because in one night she lost 5 patients because they ran out of oxygen. And this, it's not something new, but when it happens time and time again and nothing is done to, mitigate that, then it has an effect on you as a healthcare worker, because Dr. Twahiri, myself, do not go to work hoping that they lose patients. You actually want to see your patients go home and go home better than they came. So it really took a toll on her, and she actually lost her mind, and she had to get immediate emergency psychiatric care for her to go back to herself. So some of these things have an effect on healthcare workers. So there've been improvements here and there to make sure that, we are a little bit better than we were before, that we are able to handle some of these cases when they come here. But COVID-19 is one of those diseases which changes every day. Every day we are learning something new. Every day is something different. So you may prepare for this, but you don't know what you'll expect the next day. You don't know. Sometimes young people have lost their lives to COVID-19, and you cannot make sense of how they died. So it's always changing. It's always something new that we want to learn. And so I think, and what Dr. Twahir said is everyone is really looking forward to the vaccine, because if the vaccine can work, then we can all breathe a sigh of relief in terms of handling and managing COVID-19, so that we can have lives safeguarded and livelihoods still safeguarded, because that loss of livelihoods, where you come in heavily as KAM, is really a key component in terms of, if people do not have food in the household, for example, a parent will not stay in the house trying to keep off COVID-19, yet his or her children are crying of hunger. They'll have to go out and look for something. So it's always, you know, a delicate balance every day, both at a macro level, government level, and also at a micro level at the household levels. So Sally, let me just stop it there so that we can take the other questions during our Q&A.
Thank you. Yeah, I know there's a lot of questions that will come in. I know you've talked about the complex issue of the anxieties that a lot of frontline workers have to deal with, and the medical and the psychological, the mental and the psychological welfare of all of us, and especially of those ones who are in the front line dealing with the pandemic. So we can come back to that, but at this point, I'd like to bring in Mr. Aichura. Mr. Aichura, my question is that COVID has had a major impact on businesses. And other than what they're doing to comply with health protocols and measures, what have you seen them do to mitigate the impact of the crisis? And what could be the role of insurance in protecting them for future crises? Welcome.
Thank you very much, Sally, and it's really good to be on this panel. COVID-19 is first and foremost a health crisis. And Dr. Twahir and Mercy have really given us some very good insights into this. And indeed, our expectation was that, given our young demographic and the fact that some of the containment measures, restrictions were brought in fairly early on in March, that we would be spared the worst of the health crisis. But now we are seeing the second surge, and Dr. Twahir has even talked about a third surge. So I think there's a huge amount of uncertainty as to how this pandemic might unfold. But aside from the health impact, I mean, this is having a much, much bigger economic impact on individuals, businesses, and the country at large. And I feel that the knock-on effects of these will last probably much longer than COVID-19 itself. The Vice Chair, Rajan, spoke about some of these things. And if you look at the KAM Chairman's write-up in the Business Daily today, he's really articulated this impact very well. I mean, we're likely to see a contraction in GDP for the first time ever. Businesses struggling, the increase in unemployment, the pressure on the Kenya shilling, and government revenues. And I think it's important just to spare a couple of minutes appreciating the nature of this crisis. I mean, this is a 1-in-100-year event, one that none of us have previously experienced. We were unprepared, and psychologically, it's a very difficult terrain. There's a huge amount of uncertainty. How long will this disease last? Even this vaccine, when will it get to us? How long will this containment last? And will we have to keep on doing this each time there is a surge? And as I said earlier, what will the knock-on effects be? And I think we now know the true meaning of the word disrupted. And also it's useful to understand that this is not a normal recession. This is a recession, or this is a slowdown that has been caused by a supply shock. People get the virus, they can't come to work. But more importantly, because of the containment and the restrictions, people can't go to work. Because people can't work, because of the slowdown in our markets, we have a demand shock. People don't want our goods. So this is not a normal business cycle recession. And yes, we appreciate the need for this containment. The more we have to contain, the steeper will be the recession or the slowdown in our economy. But look, as you said earlier, Sally, yourself, I mean, KAM's objective is to keep the country going. And yes, I mean, I think Kenyan business has generally been very resilient, and we must give it to us that, things could have been worse, as Rajan said earlier. Yes, some businesses have really been hit, been decimated, especially the hospitality industry. But by and large, it has not been as bad on the business front as was earlier anticipated. Almost every business sort of did scenario planning to model how this would affect us, and hopefully, look, it's not going to be as bad. Now, the first instinct of most businesses has been to cut costs. It's a survival game, preserve cash. But as someone once said, a crisis is a terrible thing to waste. And I think this is also a time for us to start thinking about repositioning, reinvesting, looking at the change in customer needs, look at how business will be done differently in the future. There's a huge push towards digitization, automation, and I hope that businesses are taking advantage of that. But now let's come to insurance, because Sally, it's said that post-COVID, we are not going to see a normal. We're not going to get back to normal. It will be a new normal. And there are some very useful lessons to be learned here about the future. Yes, there's been the impact on people, the huge disruption to business and business operations, but also this pandemic has highlighted the potential exposures to business and also to individuals. And this is a really good time for businesses, whether they're in the service industry or in the manufacturing industry, to properly understand their insurances, what is covered, what is not covered, what precautions we can take to control losses, and how we can use insurance to better protect our businesses as well as the people who work for us and ourselves as individuals. Let's just talk about, for example, remote working. And I would appreciate that for a lot of manufacturers, most of their staff would need to be present to operate those plants and machinery to work. But there could be admin staff, finance staff, HR staff who don't come into work. Remote working introduces new challenges, where people are working from, network security, the risk of loss of company information, exposing critical company information, confidential data. And this highlights the need for things like cybersecurity cover. Most businesses have business interruption policies. These are designed to protect against loss of income when there's any fire or damage or burglary or some equipment not working. Now, how many of us look at those policy wordings closely? Yes, COVID-19 is not covered, but if you look at those policy wordings carefully, there's things that we can do. What about supply chain disruptions? Maybe there's a need for contingent business disruption policies. What about directors and omissions cover, right? I mean, Kenya is becoming a very litigious country. Tomorrow you could have stakeholders or even your shareholders take you to task that you did not manage the business properly, you did not have adequate contingency plans in place. Medical professionals could be taken to task, anybody could be taken to task, right? So I think it's a really good time to audit all your insurance policies, their provisions, to identify gaps, overlaps in coverage, to have a risk policy if you don't have one, review and modify your existing contingency plans, because today it's COVID, tomorrow it could be something else. And what would be the impact on your business of a long-term closure? Review all your asset registers. I mean, identify all the equipment, services, third parties that are critical for your continued operation. And make sure that you have minimum required and recommended insurances to safeguard your business. And again, most people don't know how to make a claim, right? Put in place a clear processes that on if there is a claim, what is the impact it could have on your business, and how do you track all your expenses, everything that you incur if there is a claim. So the point I'm making, I mean, maybe I'm a bit biased here, is that it's important for businesses to seek the help of a proper insurance professional who is qualified to guide you, review your insurance programs, and recommend solutions. And whereas the temptation is to cut costs at this time, and insurance may be seen as one of the costs to cut, I would be cautious about this cost-cutting response. In fact, now is the time to see what is the benefit of insurance to safeguard our business or us as individuals. We are seeing a huge take-up or an interest in things like life cover, health covers, and I'm hoping that one of the legacy of the corona crisis is it will propel businesses and individuals to seek better protection for themselves and the people who depend on them. Thanks, Sally.
Thank you, Mr. Aichura. No, I think at this point, we can all use all the help that we can get. So we do appreciate all these insights from you. Reviewing our asset registers. I mean, I think some people haven't done that in years, and it's good that you're saying that there's no normal to come back to. I mean, we need to start looking for another way to describe that, because we are not going back to that. That part of our lives is over, and we are entering into a new part. But coming back to Dr. Tahir, and you were right that we were going to actually go into the discussion on vaccines with you. We've seen a lot of talk on that on the internet. I think that's the current topic. We watched a very passionate speech by Dr. Anthony Fauci at the White House, and then he was talking about the advancements that have been made when it comes to the developing of this vaccine. And so we are breathing a sigh of relief. We're like, oh, at least there's light at the end of the tunnel. But as our vice chair said, it looks like it's going to be a very, very long tunnel for us. But what do you think about the feasibility of this vaccine? And what, in your opinion, is what do you think about all this conversation about the vaccine?
So there's very interesting conversation going on the vaccine, but if you look at the first stage of vaccine is infection. When you get infected, you are basically vaccinated. If you recover from an infection, then you get some immunity. So we don't know how long this immunity lasts. We think that once you get infected, the immunity that you get lasts from 3 to 6 months. From the epidemiological studies from the countries that got corona before us, we think that that might not be true, that the immunity might last a little longer than that. But how long, we don't know. Remember that the first case was only reported in December, and now we are in December. So this has been going on for not even 1 year yet. So there's a lot of information that we don't know. And this goes to the issue of Tanzania and what will happen in Kenya as well. So if you allow me to just digress a little bit, because Tanzania abandoned all measures, they had a massive influx of patients who are COVID. And these were not reported, but we do have a hospital there. We know that our hospital in Dar es Salaam was completely full. But then all the patients disappeared. So it can't be that they are being hidden, because they would have ended up in those hospitals. So there is a significant decline in patient numbers in Tanzania. So similarly in Kenya, the first drop of our COVID numbers was that enough people who were exposed got infected and did develop some level of immunity. That immunity then lowers the number of people who get infected. But then new people also get infected. Now, will those people who got infected, will they get reinfected? Some cases, anecdotal cases, are saying people who have gotten reinfected have gotten worse infection. So the jury is still out there. This is something we don't know. Now, when we talk about first wave, we are assuming that the country is homogeneous, that the entire country is going through the same process. Whereas we're going through our second wave in Nairobi, you might find that West Pokot is going through their first wave. So you as manufacturers having branches all over the country, we are not all at the same level across the country. So there are some areas that will be going through their first wave now, when Nairobi and Mombasa and Kilifi and Kwale are going through their second wave. So, and unfortunately, some of these parts of the country don't have the same facilities that Nairobi and Mombasa and other urban areas have. So we expect that those counties will have more disruption in terms of work and in terms of health. Now, coming to impact on health, part of the first things that you cut is cost, as has been correctly stated. Some of those costs are medical insurance cover for your staff. So next year, you'll say, instead of giving everybody medical insurance cover, let's cut that down. At least somebody gets to take home some money, better than nothing. And the first thing you'll cut is benefits. When you do that, 80% of our patients in private hospital, both Aga Khan, Mpisha, Nairobi, Mata, Karen, 80% of the patients are from medical insurance providers. So if these patients dip, it will impact the hospital significantly. And the knock-on effect of this is that the hospital will cut down on investment on capital items and growth. So we will see slowing of growth in technology in the hospital in the coming few years or so. So it has a knock-on effect. Now let's come down to the specific vaccines that are out there. We need to bring in a bit of sanity into the whole discussion on vaccine, because the vaccines that are there, it's a new technology that has not been used before. Because of that, the RNA technology to make vaccines, it comes with its own challenges. For example, the fact that some of the vaccines have to be stored at between -70 and -90. Now, how many of us in this country are able to sustain a -70 or -90 in the distribution chain of those vaccines? So the vaccines, Moderna, Pfizer, these are vaccines that require very, very cold temperatures. So that itself will hinder our vaccine distribution. We might be able to have it in Nairobi and in the Aga Khan and the Nairobi hospital, but as we spread across the country, this might be a challenge. Now, fortunately, we do have a new vaccine from AstraZeneca that can be stored at fridge temperatures. We have a vaccine from Russia that can also be stored at fridge temperatures. We have two vaccines from China. One of them was stopped because of serious adverse effects on volunteers. So there are vaccines that are being tried out there. Some of them today, Pfizer vaccine has just been approved for emergency treatment in Britain. We are waiting for approval from America. So before we even get them to Kenya, the logistics of distribution of the vaccines coming to Kenya. So fortunately, the Oxford vaccine, the one of AstraZeneca, is collaborated with Oxford University. We've had trials being done here in Kenya as well. So we will know whether it is effective in our population or not. The interesting thing about the AstraZeneca one is the doses seem to determine the immunity. If you give 2 full doses, and all the vaccines so far are being given in 2 doses, 1 month apart. If you give the 2 full doses, they seem to be lower efficacy than if you give the first half dose and the second full dose. It seems to be more efficient that you reach immunities of 90%, even the AstraZeneca vaccine. What am I saying is that we don't know enough about the vaccines. They are most definitely welcome. It will be a really big boost. Vaccines will help us to develop our herd immunity much faster. Now, the catch in this is, what are the long-term side effects of these vaccines? We haven't tried them even for a day, so we don't know yet. So even as we go into vaccination, we are still on a trial phase, and this is trial in the population. And we have to continue collecting data to understand what are the intermediate side effects, because the ones they've tested are the immediate side effects. They've shown these vaccines to be safe. But what are the long-term side effects of these vaccines? We don't know, and we can only know with time. So risk-benefit analysis, it is safer now to use the vaccines than to expose people to COVID and they get infected. Even the ones who get infection after vaccines, they tend to have milder infection. So cost-benefit analysis, yes, we should use the vaccines. Now, these vaccines might open doors to other vaccines. The last time our CS Mutahi Kagwe of Health was quite skeptical about vaccines, and people laughed at him, but that was right to be skeptical. We've never had a vaccine that is 90% efficient or effective, never. Influenza vaccine is doing about 30%, even that is far from the truth. So to be cynical about a vaccine that's 90% is completely new territory. So will this then spur other vaccines? So will we see downstream meningitis and influenza and other conditions using the same technology to develop these very high efficient vaccines? We don't know yet. So this is a new technology that is giving us science fiction type of efficacy of vaccines. We've never seen this kind of efficiencies in vaccines before. HIV has been there now for very many years. We don't have a vaccine for it. Perhaps this might open doors once this COVID pandemic slows down with the vaccination, that we will see other diseases coming under control, and then the impact of this with population growth and aging population and more downstream effects. So I think there's still a lot that we are learning about COVID, and about the vaccine, and about the science of it and the impact of this. Thank you very much.
Thank you. Thank you. So optimistic, but cautiously optimistic, and very much on the cautious side. So let me bring in Dr. Korir here. Dr. Korir, I know you've talked about, I know you've mentioned the fact that we had broken systems before COVID, and then COVID sort of opened our eyes to how broken the systems are. And from your work as a journalist, and going through the data and information that you go through, do you think this awakening, this insights that we've had into our healthcare, are they translating into any kind of action? So is anyone looking and saying, in the next 5 years, should there be another pandemic, this is how prepared we want to be. What is your take on that, Dr. Korir?
So, it would be very good and encouraging if the answer was a strong affirmative. So the conversations are, yes, we should be ready for the next pandemic, because this is not the last of the pandemics. As long as we still have human-animal interaction, anything can happen, so it would be very good if it was a strong affirmative. And I say a strong affirmative because there's the conversations that happen, and then there's what we see actually happening in our facilities, in the community. So there are definitely some wins which we'll take from this pandemic in terms of increasing our human resource capacities in our healthcare facilities. Definitely it will improve, it will not be the same as it was before. In terms of our healthcare workers being prepared and ready for the next pandemic, that is okay. That is actually work in progress, because everyone now is on high alert and everyone is keen, to be able to manage a situation like this. And I can see, because I started reporting on COVID-19 in March. I went into an isolation facility at the time, and there was tension, there was anxiety. People are not really sure about what was happening, if they could contract the virus, what would happen. Then I went into an isolation unit again in September, October, and people are now a bit more confident about what they were doing, what they were managing, how they were handling patients. So in terms of the healthcare workforce, I can see some significant improvement. Now, what remains wanting is the state of our healthcare facilities. I wish we could have more healthcare facilities being able to handle critical care. And in this case, it's not just about putting in an ICU bed and a monitor. It's about, is it well staffed? Does it have enough support in terms of your laboratory diagnosis and your radiological diagnosis? Do you have the X-rays and the CT scans that you need? Do you have round-the-clock laboratory, support? And most of our healthcare facilities in the peripheries do not have this. People are really keen on, we've put up a building, we put beds, and they think that is a facility that can handle people. That's not about it. So I wish there could be more progress in terms of that, more resources put into that, and more training and capacity building of our healthcare facilities and our healthcare workers in order to handle that. But that's at the curative stage. At the preventive stage, where we come in now as journalists, as public health officers, specialists, what does the public know? Is it all about top-down communication of how to manage a pandemic? Do the people understand? If something else comes next time, would people know what to do, or would people be reacting more out of fear, let's say, of being found in the wrong places? And I remember, and probably these are some of the things that contributed to the stigma around COVID-19, is at the very beginning of the pandemic, the minister says, if you're caught outside curfew hours, or if you're misreporting, we will send you to Mbagathi to go and report from there. That gives a certain image of, this is something really bad, it's a monster. And when people have that image in their minds, then people start responding out of fear more than out of an understanding and a place of knowledge about what is happening. So I wish there's more that is done in terms of what the communities, what the populations know. I wish we could do more to engage our community health workers. We have used them before in HIV, in TB, in trying to improve our access to contraceptives, that is family planning, and it has worked. But in this pandemic, I've not seen a lot of engagement of these people. And when you go to our mashinani areas, our counties, these people actually know whose household is, where is it located, how far is it, how many people are in that household, who has fallen sick, do they have even food, for example. So able to even know who can do home-based care or not. So I wish we could have done more to incorporate these people. The other thing that is a plus, and I hope we will have more improvement on this, and we saw our manufacturing improve. If you could have more homemade, homegrown solutions for our problems, one, the costs will significantly reduce. And we saw this with the mask. Initially, mask that you could buy a box of 50 for 200, all of a sudden was retailing at 1,000. But when we started local production, then the prices came down. So it will do a lot in making our healthcare services more affordable if you could have more of these things being manufactured locally. Our sanitizers, we don't have to import sanitizers, we can do them locally. Masks, personal protective equipment, and then we can move a step higher to even manufacture some of the things that we use in our hospitals, like the drips, for example. I wish we could manufacture more medicines, because as a country, if you are to take a full dose of diabetes medicines that are manufactured here, it will probably cost you like about 500 shillings for a whole month's dosage. But if you buy the imported medicines or the branded medicines, then you get that it costs you 10 times that. If we could have that capacity done more, then there will be a lot of support by the manufacturing industry into the healthcare system, such that the next time there's a pandemic, then we know that there are some things we can handle in-house and even export and support the people around. So we have done some bits. We have seen what our capacity is. We've definitely seen that we can do better. And I think from here on, it's just adding on to that, so that it's a stepwise improvement by everyone, by every facet of society, to support the healthcare system. And as you can see, though this has been a health emergency, it has been an emergency in all other sectors. I mean, almost all societies ground to a halt because of this one health emergency. So I think it's time that we did more. We've done enough, but I think we can do more.
Thank you for that insight, and it's a good thing that you mentioned the stigma. I think we are still dealing with stigma of other diseases, and redefining and refining them and breaking them down into local languages in a way that people can understand. Then we have now this new phenomenon that even we who are supposedly in the urban spaces do not really understand it and cannot speak about it very confidently, to then get to a point where we are finding ways and languages to speak about COVID-19 in a way that is less stigmatic for the people who contract it. One wonders how long that journey will be if it took us that long for HIV and the likes. So, but thank you for mentioning that. Coming back to Mr. Raichura, and I know that you are expecting this question, but there's been a public outcry on COVID-19 not being covered by insurance companies. And I'd like to understand what your take is on this.
Yeah, Sally, absolutely. I mean, there's been a lot of public disappointment and even anger as to why COVID-19 is not covered by medical insurance plans at a time when the country probably needs it the most, right? And lots of people have asked me as an actuary, why is COVID-19 an exclusion, or is it just insurers hiding behind policy wording and their reinsurers? So look, as I said earlier, COVID-19 or a pandemic is a 1 in 100-year event. And it's like, whether it's COVID, whether it's a pandemic, an epidemic, or even political risk or terrorism, these are deemed to be major impact events. And if when pricing an insurance policy, you model these and allow for these, it could make the medical insurance unaffordable. And therefore, there's a balance that needs to be struck between having affordable medical insurance and what is covered and not covered. Right. But having said that, look, in response to the public pressure and demand, the insurance industry is responding. Almost every medical insurer in the country now has a COVID-19 cover. Yes, for an additional premium, but it is there. As Zamara, we're working with several health service providers to come up with COVID packages covering testing, covering hospital stay as well as telecounseling for home-based care. So yes, the industry is responding, and we hope that with time there will be more products and innovations to take care of maybe not a pandemic, but other illnesses and critical conditions that will arise in the future. And Sally, at this stage, I think I should also talk about WIBA, right? WIBA is a statutory cover covering accidents and occupational illnesses whilst at work. And the public argument would be that if you get exposed to COVID whilst you are at work because another colleague had COVID-19, this should be covered. Now, if you look at it from the insurer's point of view, they will want demonstrable evidence beyond any reasonable doubt that this happened because of exposure at work. And this is sometimes difficult to prove unless you have properly implemented the DOSH recommendations on return to work. So I'd recommend, every employer needs to look at these DOSH recommendations, do an audit, and ensure that you are compliant. The situation would be different with healthcare workers who by the very nature of their work, are being exposed to COVID-19, or people in the hospitality industry who would be exposed, right? So there's lots of gray areas. But the other thing I would also say, Sally, is the importance of life cover, because sadly, so many people have lost their lives. And I would encourage, every KAM employer, right? Group life cover is cheap. For 0.5% of salary, you can cover twice annual salary for your staff. I mean, this would give a huge amount of safeguard and comfort to workers in Kenya. And I would strongly encourage every employer in the country. In fact, I would argue that it should be legislated, that just like WIBA is a statutory cover, life cover, because you could die not whilst working, right? And so many Kenyans are vulnerable to this. So again, Sally, I hope I've answered your question. There's no perfect solution here.
While you're on that,
industry continues to evolve.
Yes, while you're on that, I'd just like you to probably comment on how this has impacted the pensions industry and what can be done.
Yep, again, the slowdown has had a big impact on the labor market as well as the financial markets. People have sadly lost their jobs, especially in the hospitality industry. There's been retrenchments, there have been reductions in salaries. Many employers who have pension schemes have suspended contributions, reduced them. But the bigger point here, Sally, is that at least those who had a pension saving and were sent home got a cushion because a pension saving came in to help them. Now, imagine the millions of workers in Kenya who don't have any pension coverage at all. And this is the sad reality in Kenya. And I really like what Dr. Mercy said, like that parent who has to go to work because there's no option, because you need to put food on the table. And look, everybody has been affected by the crisis, but the impact on millions of Kenyans, especially those who are not salaried, has been disproportionate. And I think this raises important questions about the type of country we want to build and the plight of people, right? And I would say, even our president aptly described this dilemma as, the dilemma between lives and livelihoods, right? We need to do something about this. And, there's 85% of our population doesn't have any pension saving. Now, at least for those of us who are in the formal sector, those of us who are working for the Kenya Association of Manufacturers, everybody should have a pension cover. And to those manufacturers who say, well, this is going to be a cost increase, I would say that if you have a gratuity, it's actually cost neutral. And today you can have a simple, totally digital, paperless, hassle-free retirement saving solution for your staff. And the onus is on us to make sure that more and more of our people have that financial cushion so that a future crisis will not affect us as badly. Because look, it's really sad to see the state of affairs that people have been in. Yes, there's been a massive outpouring of support, help, all businesses, everybody has come together. But clearly, Sally, this is not sustainable. Why don't we empower people, give them that gentle push to save in their lives by offering them a means to save? This COVID-19 crisis to me, Sally, is actually a trailer to a much worse crisis that we will face as a country. If it was hard enough to take care of our people during these few months, How much harder will it be when 17 million Kenyans can no longer work in their old age? We will face an exponentially much larger crisis. Inaction is not an option.
Well, that's quite a dystopic future there, Mr. Aichura, but absolutely, your concerns are absolutely valid, and I think those are things that we really need to start thinking about as a country. And for the future of our country, really, where are we going? Where are we going if our systems are not set up to hold us to a better future? But back to Dr. Twahir, as we are winding up, I see a question here on hospitals. I know that Mr. Aichura has talked about what insurance companies have responded to and have come together to decide, okay, let's now offer packages that cover COVID-19. And there's somebody who's asking, is it true that hospitals are trying to maximize on income during this situation? We've seen the sacrifices by individuals working in hospitals, but maybe you can respond to this. And I know they've asked another question, which I think you had earlier touched on, is that the BBC has reported that Kenya has resolved to order massive doses of COVID vaccine from China, and the Western world has expressed concern on the efficacy of the vaccine, which I think you've talked about the vaccine quite in depth. So maybe you can respond to this question. What's your reaction on our decision to order vaccines from China? I know you had talked about China, and I know you had said some of the trials did not turn out very successfully and had adverse effects on the volunteers. So maybe you can comment on those two questions as we begin to wind up.
So very quickly, all vaccines that are being distributed worldwide have to get WHO approval. So the one that was had serious side effects in China, that is not a candidate for distribution. But there is one safe vaccine that is still being tried in China. So if you consider that China was the first country to get COVID, it makes sense with the level of technology that there would be some way forward in developing vaccines. So I don't think we need to be too skeptical or cynical about vaccines from China, wherever we can get the vaccine from at a reasonable price, because by the time America distributes vaccines to all Americans and the Europe distributes to all the European, by the time it comes to Kenya, it might be really in 3 years from now. So we might as well look for other options out there. So I don't think Kenya, we have enough intelligent people not to get vaccines that are of poor quality. I have no problem about getting vaccines wherever it is, as long as the vaccines that has passed through WHO guidelines and recommendations, we will be safe. Now, in terms of the hospitals maximizing on COVID, that could not be further from the truth. Hospitals make most of their money in the first 3 days. That's when you do all the investigations. That's when you find out what the patient has. That's when you start treatment. Subsequently, when you stop investigating and patients are occupying hospital beds, there is no money. There is no money in beds. There is money in investigation. So most COVID patients would make most money in the first few days. But remember, COVID patients last in hospital for 10, 14, and some even for 3-4 weeks. So compared to other patients, COVID patients actually make less money than non-COVID patients. That's number one. So it's not true that COVID patients, in fact, when we calculate our income per patient per day for COVID in terms of projection, we scale down significantly to less than 50%. So COVID doesn't make money for the hospital. It makes significantly less. Now, in addition to making less, many patients who come into hospital and rapidly deteriorate, even the ones who have insurance cover, they exhaust the insurance limits. These patients fall into bad debt. They cannot afford to pay. Now, especially if they end up in ICU. ICU care costs over 100,000 shillings a day. So in a few days' time, patients have accumulated bills of 14 to 18 million shillings, and they never anticipated it. We can't switch off the vent. These patients, many of them have gotten better and gone home, but then they are bad debts. So in addition to making little money from COVID patients, COVID is also a big contributor to bad debt. So in addition to that, again, in Aga Khan specifically, all our patients who come into hospital are screened for free. for COVID testing. And this was done to encourage people to come to hospital so that they know that they are safe and the staff know which patients and what precautions to take on the patients. So the patients who who are COVID negative and do not require full PPEs, they are then treated in a much cheaper way than the patient who's COVID who requires full PPE. That patient is much more expensive. So it's a complete fallacy that hospitals are cashing on COVID. We would prefer that the COVID pandemic ends and we go back to our normality. If we were banking on COVID, we would not take a pay cut. The Aga Khan Hospital, we've taken a significant pay cut for all our staff. If we are just normalizing that, and we were full of COVID patients, yet we still took a pay cut because we were not meeting our revenue requirements. So I think I've emphasized enough that COVID is not a money maker for hospital. Most of it is just being done because we are Kenyans and we do it. It is our duty to treat Kenyans. Thank you.
Thank you. Thank you so much for that clarification. I'd actually heard that those kind of rumors and seen those conversations online, and I just wasn't sure what was happening. But thank you for clarifying that for us.
Sorry, Sally, if you'll allow me, there's just one more question here that has been put about the rollout plan in case we get a vaccine. Just very quickly, I think the government, I've worked with the government a few times. I'm sure there's somebody who's working on who to prioritize. In the hospital, we are prioritizing even before the vaccines come in. The first people to get the vaccines will be the people who are intubating the patient, the people working in ICU, nurses first, followed by doctors, followed by the people who go into patient areas, then administrators will be the last people to get the vaccine. So this is already under discussion, but nothing firmed up yet. This is in the early stages. Thank you.
Sally, allow me to just quickly add into the conversation about the cost of COVID. So KEMRI Wellcome had done a survey about an analysis about how much on average it would cost to treat COVID patient, and this is across board, whether it's private or public facility, where the actual cost for somebody who's in intensive care, for example, was about 71,000 per day. And somebody who just has mild symptoms and they're in their regular facility, it was about 21,000. Then obviously the people in home-based care would cost them about 2,000. So when you look at these costs, and Dr. Twahir has covered this, whether you have insurance or you're paying cash, it is still hefty. I mean, if right now you're supposed to pay 71,000 per day to be in intensive care and people stay there for 2 weeks, 3 weeks, 1 month, how many of us can afford that? And then I think this circles back to what Raichura is talking about, that it's about time that we look at how to cushion our employees, ourselves, from the costs of healthcare. And this is just for COVID. Healthcare is always expensive, only that in societies where they have done universal health coverage, like in Thailand or in the UK, there is a bit of relief for the people who need to pay because it is tax funded. And that removes a lot of burden from people who need to pay out of pocket. In Kenya, for every 10 shillings spent in healthcare, 3 shillings is out of pocket. We're spending up to 30% as out of pocket to pay for healthcare services. So you can imagine what the cost implication what that cost implication is. On an individual level, as employers, your employee will be more stressed. Their productivity will go low because now they are stressed. They have a debt with the hospital to go and pay. And so they are working towards, clearing a debt, yet they could be working towards a better quality of life. So this for me is usually a chance for a bigger conversation about how do we cushion ourselves from, the burdens of healthcare. And this does not mean that if I have an insurance cover, I am safe. Because most of us as an African society, we have dependents in our villages, we have dependents elsewhere that, will call on you, especially if you have a job, they'll call on you. They're having a harambe, somebody in the village is having a harambe. So in one way or another, you end up paying indirectly for healthcare services. But I think, as I said, COVID found us in a bad situation, but I think it's a wake-up call to find out how do we sort out the mess we are in, such that when the next pandemic comes, We don't have to think about, will I pay for that test or not? And we saw that for Rwanda, because the government testing for COVID was free, they were able to do more robust testing, more contact tracing, more isolation and quarantine for COVID because the government foot some bills. But here in Kenya, if you're asking me to pay 5,000, 10,000 shillings for a COVID test, yet I cannot afford 100 shillings for food in my house, I'm not going to test. So chances are I will be infected and I will still go back to work. And when I go back to work, I will infect other people. And before you know it, you're shutting down a whole organization because somebody could not afford to do that one test that could have mitigated these other effects. So there's a whole bigger conversation that affects whole of society when we start talking and thinking about the cost of healthcare. All of us are affected. So we should find a way of making sure that all of us are covered. We reduce that 30% out of pocket expenditure in healthcare to even about 5% or less, so that it makes it better and easier for people to access healthcare services wherever it is that they are in the country.
Thank you. There was a question for Dr. Choi here on Tanzania and them claiming that they don't have any cases, but I know that you covered that when we started to have this conversation. So I'm winding up because we are also running out of time, but as I do that, let me just ask each of you to give some final comments on this. And I'll start with Mr. Raichura. Mr. Raichura, as you answer this question, you can also give your final comments. You're the chairman of the Kenya Pensions Fund Investment Consortium. What is it and that pension funds would be, would pension funds be willing to invest in manufacturing? Maybe you can comment on that as you give your final remarks.
Thank you, Sally. The pensions industry in Kenya is 1.3 trillion shillings. And I'd like to see that part of this money goes towards building the country. We have more than 80% of the money in our pension funds is invested just in government securities, fixed deposits, and a handful of stocks and shares on the Nairobi Stock Securities Exchange. But we're not really investing in the real economy. The KAM manufacturers are part of that real economy. And we would love to see, how we can help manufacturing as part of the government's Big Four agenda as well. I think there's a need to see how instruments can be structured so that, we can provide that long-term investment that will be needed to boost our country, right? So we are holding discussions with policymakers, and we'd love to engage KAM on how we can look at supporting manufacturing, because look, a lot of the funding can be availed in the country. And just going back to Dr. Korir, right? I really feel that, healthcare is another major area of that needs investment. And it would be very well suited for the long-term type of investment that pension funds ought to be interested in. Now, just in terms of parting shot, unlike Dr. Korir, I hope that we don't see another pandemic for another 100 years. But there's been lots of useful lessons from this pandemic. And I hope that as a nation, we will learn from them. And again, there are things that we need to do as individuals, things that we do as corporates and businesses, responsible corporate citizens, as well as stakeholders in our country. And I look forward to further engagement on how we can do these things together. So once again, Sally, Mushai, and Rajan, and Phyllis, thank you for having us on this panel.
Thank you, and hope we can continue to engage you, Mr. Raichura. I think you have some very useful nuggets for us going forward, and we might want to call you for another larger discussion. So thank you so much, Dr. Twahir. Please, maybe you can give us your parting shot, and then we can have Dr. Masikorir with us.
So whenever I talk about COVID, I see a lot of people when we drive around and walk around without masks. So I always advocate for personal responsibility. Similarly, we see our models, the politicians without masks, without exercising social distances. I think we need to hold them to account for that, that every single person must have their masks, every single person must exercise social distances. We say either you keep 6 feet vertically or 6 feet horizontally, you choose which one you want to take. So having said that, challenge to manufacturers in this country, you have risen up to the occasion with the PPEs. You are scaling up now to looking at more complex manufacturing, the hospital beds, the ventilators. This will not be acceptable in most hospitals unless there is a standard that then you set up and adhere to. So as you manufacture the high-tech equipment and go into monitors and cardiac heart monitors and things like that, please simultaneously set up very high standards that you work to meet, so that the equipment, the beds, the ventilators, the cardiac monitors, the even scissors, unfortunately, surgical scissors we're importing from outside, surely manufacturers in this country can meet those standards and make them locally. And that will spur not only our economy, it will save us from wasting our foreign currency importing things that we can do locally. It will improve our jobs for our fellow Kenyans. It will generally have a very positive effect downstream. Thank you very much.
Thank you, Dr. Trahe. We really appreciate that, and we appreciate you making the time to be here. Dr. Korir, you can make your parting shot, and then I can hand it over back to our Vice Chair.
Okay. So COVID has presented, I think, everyone with, much as it's a crisis, it's a challenge, but with opportunities to reinvent, re-engineer, reorganize, redevelop, remodel. And so I think for me, one, for your membership, it's a time to rethink business. It's a time to rethink how to tap into the healthcare space, because COVID has exposed, the deficiencies in this particular field, and where, and we've seen manufacturers can come in heavily and plug into that hole. So I think, one, it's an opportunity, much as it's a crisis, for manufacturers to plug in and do their part to support Kenyans. The second one is that the pandemic, the virus is here to stay for a while. Much as there's a vaccine, there's the COVAX call by the WHO, where governments will get 20% of the vaccine. I will get the vaccine for 20% of the population. We should be alive to the fact that we are in a low and middle income economy where we are not top of the list. So by the time we are getting this, then other people will have already gotten this virus. So the onus is on us, and to take that personal responsibility, that one, to avoid closed and crowded spaces, and to avoid staying in places that are not ventilated for a long time, to always wear our masks when in public places, wash our hands, sanitize, all of these things that were foreign before March, to make them a regular, both in our spaces at homes, both in our spaces at work, because by the time we get the vaccine and we get this herd immunity, then we need to have prevented ourselves from getting this virus. And even when the vaccine comes in, there are some demographics that will be prioritized before everyone else. So I think it's that personal responsibility, to be aware. And also the third and last one is to always keep tabs on what's happening. COVID is always changing. We started with a 14-day quarantine isolation. We've gone to 10 days. We started with, we don't know what's happening. Now we are starting to see what some of the long-term effects of COVID are. So I think for me, the third and final one is that all of us should take the initiative to always be informed and always be up to date with what is happening in the COVID field, because that could be literally the difference between life and death, the difference between you going to hospital as soon as possible and getting help, and staying back at home and losing your life to something that you could have done, because it's always changing. Let's be up to date with what is happening with the virus. And that's why we are here to always bring those stories.
Thank you. Thank you, Marcia. Thank you very much to all of our panelists. I feel like this could really have used a much bigger discussion. We have questions around how will the human behavior change, and maybe the doctors would probably have answered. Right now, I think we take a step back. We're just used to extending our hands to say hi to each other. And now it's like, it's almost, so how does that change, and how does that change our minds as we adapt to what Mr. Raichura called the new normal? But right now, I'd like to hand over back to our vice chair, and I can see that our chair and our CEO joined. So, Mr. Rajan, and I think somebody also asked how we are lobbying for manufacturers to continue to manufacture, seeing as power and operation costs are high. But I think also Mr. Raichura also talked about some of the things that we've been lobbying for as manufacturers, and even as latest as today, you can see that we are still doing the work of advocating and talking to government about what can be done. So welcome, Mr. Rajan Shah. You can close for us as you invite the chair and the CEO.
Okay, thank you, Sally, and thank you to all the three panelists. It was really a good, engaging discussions on COVID, and I think it's one of the common threads which seems to be coming out from the discussions, if I kind of go through, is that there is opportunity even in times of adversity. And this is what we have to kind of embrace, to look positively. Yes, Dr. Twahir, we as manufacturers, we take cognizance of the fact that as manufacturers, we will rise up to making to the international standards, but manufacturers have also taken very bold steps locally with the first ventilator ever to be produced in Kenya. However much it will, of course, I'm sure within the next few years, we will have to a standard that it can be, taken pride of as a product of Kenya. Mercy, yes, I agree that during this time, PPEs and things that have been locally produced and have been actually very well supported by the health industry. And we've learned a lot from that on how to re-engineer, retool our factories to be able to make all these things. Raichura, Sandeep, we take cognizance of the fact that this new norm means that we have to see how to better protect for the future for our workers through either life policies, to look at pensions more as a more holistic solution to protect our workers during the times when they are going to retire, and how they are vulnerable, how this kind of pandemic has shown the vulnerability of the larger part of our populace. So I think we have to be in the reimagine mode and try and take view of how we're going to make changes in the new norm. With that, I would like to just request our chair, Muchai, and also I can see Phyllis is here as well. Maybe she can also drop in and say hello before we wind up.
Hello everyone. We've been listening in. Thank you so much, Dr. Twahir, Dr. Korir, and also Sandeep for a very engaging session. So I'm here with the chair. I'll allow him to also say something. Thank you.
So thank you very much, everyone, for that participation at that event. I want to thank the panelists who've taken time out to speak with us on an important issue. I think, like we've been saying, unless we solve the pandemic, we are not really going to solve the economy. So it is one of the key things that we need to be cognizant of, and also to play our part as manufacturers. I got the part where we were being actually challenged and encouraged. We need to play our part individually, as companies, and probably as an association. So a big thanks to the panelists. I think we will be also circulating this to general membership. So it will be one of the things about Zoom is that whatever you say now is recorded. So it will be, people can participate in meetings even when they're not here so that they can engage, and we'll be reaching out to them with the other questions at a later date. So we continue to work for the association, its members, and for Kenya. And we wish you all a good evening. Thank you.
Thank you. Thank you all. We are happy to respond to any questions. We will continue to give updates as we receive them as the association. And we're happy to put you in touch with any of the panelists that were here today in case you have any further questions. And we do thank you so much, Dr. Twahiri, Dr. Korir, and Mr. Raichura for jumping in quickly and coming to have this conversation with us. We appreciate you and do have a lovely afternoon. Thank you.
Thank
you and bye-bye.
Have a good evening, everyone.
Thank you.
Bye, everyone. Thank you.